Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, May 16th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now I want to kick things off with another save the date reminder that a week from today on Friday, May 23rd at 1 p.m., we will be holding a special Tele-Town Hall meeting. All of our association meetings, of course, are members only. On Friday, we will be holding the Tele-Town Hall meeting focusing on the investment of public pension assets. Our special guest will be Michael Trotsky. Michael is the Chief Executive Officer and Chief Investment Officer for the Commonwealth's PRIT Fund. From the PRIM board, they invest all of the state and teacher retirement monies as well as the bulk of local retirement assets as well. And as we've been saying over the past few weeks as a preview for this meeting, given the state of the economy and the turmoil, the ups and downs of the financial markets, the timing of Michael's presentation could not be better. If you have specific questions you would like us to ask Michael in advance, please reach out to me directly. My email address is contained in today's email blast to everybody. But Michael will also be taking questions live from members during the Tele-Town Hall. Again, next Friday, May 23rd, 1 p.m. There are two ways for you to participate in the Tele-Town Hall. Our preferred way and the simplest way is for you to receive the automated phone call at 1 o'clock next Friday. All you need to do is answer that call, stay on the line. You're going to be automatically connected to the meeting. Now, if you don't receive the call, or you happen to be out somewhere and you want to dial in, the Tele-Town Hall toll-free number is published on the back of your membership card. Call that at the time of the meeting. That will connect you to the Tele-Town Hall meeting. But again, the preferred method of being connected to the call is to simply receive the automated phone call from me at the beginning of the meeting. That will automatically connect you to the meeting. Now, in terms of the news of the week, unfortunately, I need to kick things off by talking about another scam that targets public retirees that we have been notified of. Over the past few days, quite a few members have reached out to us after having received an email that appears to have come from the Social Security Administration. However, this email is not from Social Security. It's a scam email. It is trying to get those who have been targeted by this, which apparently are folks who the scammers believe were beneficiaries of weapon GPO repeal and received a large sum of money through the Fairness Act. And this is something that we were afraid of from the get-go and we've talked about in the past, but here it is, it's happening. As far as we know, none of our members have fallen victim to this. Those members who reached out to us immediately identified that they believed that the email was a scam. Several members actually contacted Social Security. One member actually drove to her local Social Security office in person to report it and was notified by Social Security that, we did not send this out. We would never send out this type of email. So essentially the email is claiming that in order to process your Social Security benefits, they need to have an update of your direct deposit and banking information. And there's a link in the email for you to click to provide this information. However, that email URL is not a legitimate address. It is redirected to the scammers. Everything looks exactly as it should. All of the logos are there, the colors, it looks legitimate, but at the end of the day, it's not. It's a scam. They're trying to access people's information. From what we have been told by Social Security is that they would never send an email to you requesting that you provide that type of information online. They will also not call you seeking that information, because that's something that people have attempted to do in the past in terms of scams, is to call you claiming they're from Social Security or Medicare or the IRS or your bank, asking for you to give personal information over the phone. No one will ever call you and ask you to give them that information. Now, you may call Social Security and you may receive a letter in the mail from Social Security asking that you call them. That is typically the way they will communicate with you. They will send you a letter They will ask that then you contact Social Security or make an appointment to go into the Social Security office. It's always a good idea to verify that the telephone number that you've been given is in fact the Social Security phone number. And if you're in doubt, you can visit your local Social Security office because they would rather have you come in and have them explain to you what's going on than have anyone fall victim to a scam. So that's the number one thing we want to put out there. And in today's email blast to everybody, we're providing more information as well as links to specific information on the Social Security website of how you can go about avoiding these types of scams. Now, on a brighter note, we know that the Social Security Administration is continuing to implement the Social Security Fairness Act on a daily basis. As a matter of fact, virtually not a day goes by where we don't hear from one of our members who's calling or emailing or texting to report that their retroactive benefit has finally shown up in their checking account, or that they have finally received the adjusted monthly benefit going forward. And this is great news, because while about 20,000 Massachusetts residents remain pending in terms of your benefits being adjusted, it's good news in that this is the process is continuing to work. This has not gone stale. This hasn't been kicked to the wayside. They are legitimately, and by they I mean the Social Security Administration, on a daily basis is manually doing this work, paying people their retroactive benefit, and then adjusting and paying the correct amount going forward. So a couple of words or actually before I do that, there was an additional update from Social Security this week, and again, the link is contained in today's email blast. But according to the Social Security Administration, as of May 9th, so a week ago, 85% of those retirees who are eligible for a retroactive benefit have received their money. That accounts for about 2.4 million current retirees. Here in Massachusetts, 110,000 retirees have received their retroactive benefit, and the financial impact on the state for those 110,000 retirees is over $800 million in retroactive benefits have now been paid since the end of February. So that's been tremendous progress over just a handful of months. We are thrilled that this continues to move forward. If you're someone who's still waiting to be paid, what we again advise you to do, if you haven't already done so, is to contact Social Security and inquire where you stand. And they will let you know if you're on the list of retirees whose cases are still being worked on. They're not going to be able to tell you, however, of exactly where you stand or exactly when you can anticipate being paid. You're just going to have to be patient. And if you've already contacted Social Security and you've been given this information, at this time there's nothing further that you can or should be doing. Unfortunately, again, you just have to be patient. And members are being paid. Once again, we're hearing from folks all the time whose money has finally shown up. And it's just a matter of time before all of our members who are eligible for a retroactive and a new monthly benefit will be paid. It's just taking a little bit longer in some cases than in others. Now, if you're someone who is eligible for spousal or survivor Social Security benefits and you have not yet reapplied or contacted Social Security, or maybe not even applied at all, our advice to you is if you are eligible or if you believe you might be eligible, contact Social Security and apply for the benefit. If you're eligible for benefits, there's no reason for you to delay applying. Even if for some reason they tell you that you're not eligible, nothing ventured, nothing gained. The benefit of applying for a spousal or survivor benefit is it can make a difference of thousands of dollars per month. So again, if you have not yet applied and if you believe you're eligible, contact Social Security, call your local office. They will then initiate the application process, which could take 4 to 6 weeks, but you will know in relatively short time. The other two areas that we want to update all of you on this week is in regard to your health insurance, and specifically if you are enrolled through the state's Group Insurance Commission. You may have either read the story in the Boston Globe last Saturday or received the email blast that we sent out to our members on Saturday relating to the $240 million supplemental budget appropriation that was pending for the GIC. I'm happy to report that on Monday of this week, the House of Representatives passed the supplemental budget, and just yesterday, the state Senate passed the supplemental budget, sent it to Governor Healy. Governor Healy immediately signed into law that $240 million appropriation. So the GIC is now fully funded through the end of the year. I do know that many of you had reached out to us after reading the news last weekend of the pending deficit, and there was some concern that either health insurance claims weren't going to be paid or folks wouldn't be able to see the doctor or get access to health care. There was never going to be an interruption in your healthcare services. The fact that the GIC had a deficit did not come as any surprise to us. In fact, we've known about this for the better part of a year. The GIC began the year with their appropriation being shortchanged. So that having a structural deficit going into the year, as well as the fact that the GIC's budget, just like every other healthcare budget, has been significantly impacted by medical inflation, the kind of combined effect of those two issues together resulted in the large $240 million deficit for the current fiscal year, which ends on June 30th. Now, we have full faith that the GIC's budget has been fully funded and steps have been taken to avoid these types of deficits going forward. The new fiscal year, FY26, starts on July 1st. Now, the other news that came out of the healthcare realm just yesterday is that the GIC Commission met yesterday, and a report was presented to the 17-member commission on out-of-pocket costs for FY24, so the previous fiscal year. And while we're still reading through and analyzing the report, it was a pretty robust report, and we credit the GIC and the staff at the GIC for the work that's done on these types of reports, because there's a lot of data to go through. But our initial takeaway is that it's good news in that out-of-pocket costs, which of course are copayments and deductibles, over a multi-year period of time, on average, have decreased per person. And this is in part the result of the GIC not having increased out-of-pocket costs for several years. And FY24 was the 5th consecutive fiscal year with no out-of-pocket cost increases per se. The upcoming fiscal year, FY26, will be the 7th consecutive year without any meaningful or significant out-of-pocket cost changes in terms of copayments and deductibles under the GIC. This is great news for our members. We believe that increased out-of-pocket costs are simply the result of cost shifting and do not really do anything to address the root causes of healthcare inflation, and are inherently unfair on those members who, because they're sick or injured, have to utilize their health insurance more than others. The fairest way is to spread out those costs through the premiums, which are largely paid for by the Commonwealth and cities and towns, as well as spread out amongst all enrollees in a much fairer means than simply increasing out-of-pocket costs on those who can least afford to pay it. So we're thankful to our friends at the GIC for maintaining this policy. It also falls in line with the policy that the Division of Insurance just yesterday announced, where they are starting to crack down on insurance providers who have increased out-of-pocket costs beyond a certain percentage. And we've included a little bit of information on that issue in today's email message to all of our members as well. So with that, I'm going to sign off for today. We'll be back to you again next Friday. We hope to have a more in-depth review of the out-of-pocket cost report. We'll also have the latest news of the week for all of you. Take care, everybody. Bye-bye.